Not all eating disorders are created equal. It isn't as simple as someone who says, I really could use to lose those last 5 pounds, or makes themselves sick after eating. According to nationaleatingdisorders.org, accessed October 24, 2017, in the United States, 20 million women and 10 million men suffer from a clinically significant eating disorder at some time in their life. Today we will talk about 3 forms of eating disorders, one in the form of anorexia nervosa, the second in the form of bulimia nervosa, and the third in the form of binge eating. Anorexia nervosa is an intense fear of weight gain. It can affect men and women, and 5 to 10% will die within 10 years. And that is our first eating disorder, anorexia nervosa. What is it exactly? According to Merriam-Webster.com, accessed October 24, 2017, it is defined as a serious disorder in eating behavior, primarily in young women in their teens to early 20s, that is characterized especially by a pathological fear of weight gain, leading to faulty eating patterns, malnutrition, and excessive weight loss. But it isn't as simple as a person looking in the mirror and saying, I could really use to lose those last 5 pounds. According to medicaldaily.com, accessed October 24, 2017, errors in visual processing seem to explain why someone who is suffering from an eating disorder or body image issues struggle to get healthy. But how does it affect the body? Think of when you just got so busy that you forgot to eat. Did you start to feel low on energy, dizzy, or maybe even get a little sick feeling? Well, anorexia takes all of those feelings and multiplies it. According to eatingdisorders.com, accessed October 24, 2017, some symptoms include your heart shrinking with fluid buildup around, infertility, extreme low blood sugar, dry skin covered in fine languor hair, loss of hair on your head, and your brain could even shrink in size. Anorexia knows no discrimination. It will attack both men and women. But can it kill you? And yes, it can. According to eatingdisorderhope.com, accessed October 24, 2017, a review of 50 years confirms that anorexia nervosa has the highest mortality rate of any psychiatric disorder. And Mirasol.net, accessed October 24, 2017, states that 5 to 10% will die within 10 years and 18 to 20% will die within 20 years. Bulimia nervosa is more common than anorexia. It is overeating followed by self-induced vomiting, and 0 to 3% will die from complications of bulimia. And that is our second form of eating disorder. What is bulimia exactly? Merriam-Webster.com, accessed October 24, 2017, defines it as a serious eating disorder that occurs chiefly in females, is characterized by compulsive overeating, followed by self-induced vomiting, laxative or diuretic abuse. Bulimia nervosa attacks those who have low self-esteem. But what happens to a person who is struggling? According to mayoclinic.org, last accessed October 24, 2017, a person may develop psychological and physical problems. Some of those include poor quality of life, social isolation, depression, bipolar disorder, and anxiety. But what are some of the physical effects? Imagine if you vomited after every meal, every day, for years of your life. Eventually, the stomach acid would start to eat the lining of your esophagus and the enamel off of your teeth. According to eatingdisorderhope.com, accessed October 24, 2017, some of the physical effects are Russell's sign, which are scratches on the back of your knuckles due to self-induced vomiting, tooth decay, acid reflux, dehydration, electrolyte imbalance, and intestinal problems. Can you die from it? And yes, you can. Though the numbers aren't as high as anorexia, they are still there. According to healthyplace.gov, accessed October 24, 2017, upwards of 3% of women die from complications. Binge eating is uncontrolled compulsive eating, most common eating disorder, and could lead to obesity, which brings us to our third eating disorder in the form of binge eating. Merriam-Webster.com, accessed October 24, 2017, defines it as uncontrolled compulsive eating. And according to womenshealth.gov, accessed October 24, 2017, it is the most common eating disorder in the United States. How many of you watch the show This Is Us? In one of the episodes, they touch on the character Toby and Kate's eating disorder of binge eating. Some of the symptoms of binge eating, according to womenshealth.gov, accessed October 24, 2017, include eating faster than normal, eating when you aren't even hungry, and eating alone because you are embarrassed, followed by feelings of guilt and depression. In the episode, Kate gets angry about something, so she stops at a gas station and buys a bag of donuts, takes them out to her car, and proceeds to eat the entire bag, and afterward immediately feels signs of guilt and anger. What happens to your mind and body? According to mayoclinic.org, accessed October 24, 2017, some complications could develop from binge eating, and they may include poor quality of life, social isolation, depression, anxiety, and obesity, which could lead to heart disease and type 2 diabetes. Today, we talked about the 3 different kinds of eating disorders, one in the form of anorexia nervosa, the second in the form of bulimia nervosa, and the third in the form of binge eating. Eating disorders are not something that can just be brushed off and set aside. If you see someone struggling with it, please don't tell them to just go eat something and they'll feel better, or go on a diet and they'll feel better about themselves. Love, strength, and compassion is what they need. Eleanor Roosevelt once said, "You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. Do the thing you think that you cannot do." Thank you.